Okay, welcome back to part 2 of chapter 5 about the integumentary system. Now, let's go. We ended the last part by talking about the good effect of UV radiation helping us produce vitamin D3, which then is essential for production of calcitriol. So make sure you know that pathway very well. Okay, how do we go from the steroid compound within the skin to calcitriol in the kidney, and what calcitriol is important for. And again, we'll come back to calcitriol in chapter 6, going over the bones. Okay, so now back to the idea of having too much sunlight. So what's bad? Why is it bad to have too much sunlight? So we need a little bit of sunlight, but that doesn't mean we go out and stay in the sun for the entire day, every single day, without any skin protection, like sunscreen. Okay, so now nor do we go to tanning beds. Okay, don't go to tanning beds. Okay, because it can actually induce some mutations in your skin. Now, so too much sunlight can cause DNA mutations in the genome because UV light can penetrate our skin cells into the nucleus and irradiate the DNA molecules within. And if enough of these DNA mutations accumulate, it can promote formation of cancer cells, as we've talked about and reviewed through in chapter 3. So the other thing you notice with people that goes out in the sun a lot is that they tend to have more wrinkles on their skin. This is because UV radiation actually destroys collagen fibers, and collagen fibers, as we have learned in chapter 4, is an important structural component in the dermis layer of our skin. So if those structures are destroyed, then the skin will just sink in, forming wrinkles. So that's why it results in wrinkles and promotes cancer, because too much radiation will cause mutation and also breakdown of those important collagen fiber. So if you imagine the epidermis layer we're talking about, and then the dermis layer, and within the dermis layer we have those areolar tissue and all that stuff. And remember in chapter 4 we talked about areolar tissue having lots of these lines, right? And those lines were those collagen fibers, elastic fibers, and reticular fibers within there. So all those fibers are supposed to be serving as structural framework for what's underneath the skin. So you imagine if all those structural frameworks was wiped out. So if you wipe it out, so now you end with just no skin, no collagen fibers, if there's no structural framework within the dermis side. So now you have no support. Okay, in this area of the skin here, there's no support, and so the skin just sinks in and come back out. Okay, if there are other areas where there's collagen fibers. Okay, so that's how we get wrinkles essentially, and that's why they talk about those collagen shots or collagen pills that you take to help you build those structural framework underneath your skin to make you look more youth and help prevent wrinkles and all that stuff. Okay, all right, so now the next question you may have as well is, then how can we get a little bit of sun we need for production of vitamin D3 if the sunlight causes, all that sunlight we were talking about cause DNA damage? Because we need a little bit of sun for producing vitamin D3, which in a sense then we will make calcitriol. So this is where melanin comes in. Okay, melanin is actually acting as some sort of protection. Okay, when we have increased exposure to UV radiation from the sun, our melanocytes in the skin will increase in their production of melanin pigment. Okay, and those large melanosomes we're talking about earlier will then become concentrated in the region around the nuclei, those keratinocyte nuclei we're looking at, and they will kind of cover it. Okay, so those where we have UV radiation coming from the sun hitting our nucleus, but now we have these melanosomes hanging around our nucleus, covering it up, sort of acting like a little umbrella sunshade for all of the DNA that's very important residing in our genome within the nucleus of the cell and protect them against UV radiation. So this is why I was saying, melanin and melanosomes is not just for the purpose of giving color to our skin, okay, but it also provides as a source of protection against those UV radiation, okay, so fend off those radiation from hitting our nuclei. For example, if we go back to that previous picture here, you see this is a melanocyte, and these are your melanosomes here, okay, and let's say you have concentrated melanosome because you are exposed to the sun a little bit. Okay, you end up producing more melanosomes with the melanin. Okay, and this is the nucleus of that keratinocyte. So here comes UV radiation trying to hit that particular nucleus, but now it actually hits the melanosome instead of the nucleus. So that's why I was talking about it kind of acts like a little umbrella that protects your nuclei from UV radiation damage. Okay. All right, so let me go back to this. So, and hence it has been shown statistically that individuals with darker skin actually has lower chance of developing skin cancer compared to those with paler skin, and which was why I was talking about those with albinism have a much higher risk of developing skin cancer is because they have paler skin. Okay, and the reason why most individuals will have sunburn before getting darker tan skin is because the production of melanin is actually rather slow. Okay, it only peaks around 10 days when we're talking about how long the melanosome starts being produced and moved around by your melanocytes. So after spending a few hours in the sun, for some individuals, instead of getting a nice tan, they may end up looking very red, and you have that painful skin to even where light touches on the skin is ouch, really it hurts a lot. Okay, it's because it's literally burning your skin under the sun, okay? And we'll talk about the different degrees of burns. So sunburn is actually considered as a first degree burn, okay? We'll talk about burns at the end of this chapter. Now, there are two main types of skin cancer. Let's say, unfortunately, a person does have too much sun or UV radiation of some sort, and now those skin cells, nuclei was damaged and accumulate some sort of mutation that led them to develop cancer. So one type of cancer is a safer type called basal cell carcinoma. This is still, compared to cancer, the news of having cancer, basal cell carcinoma is actually a better of the news, okay? So these is dealing with cancer cells that originate from the stratum basale layer, and it is the most common form of skin cancer. And luckily, metastasis actually rarely happens if they are treated for these basal cell carcinoma. They usually develop after years of frequent sun exposure or indoor tanning. Okay, so even though they aren't as dangerous, it is still important to treat them promptly, because they can grow deep into the tissues and penetrate the nerves and bones, and possibly then the cancer cells will move into other areas. So even though they're not dangerous in the beginning and not really infiltrating anything yet, but it's good to get rid of them if you have them in case they move on deeper into the tissue. Not saying that they will for sure, but it's better to just get rid of it. Okay. All right, the second type is more dangerous and aggressive form of skin cancer called melanoma. This is when melanocytes themselves are growing out of control, okay? So they can metastasize to other tissues and organs and through the lymphatic system and circulatory system we talked about when we talked about the topic of cancer. Now, for melanoma, it usually starts as a small brown spot, and it will evolve in shape, symmetry, and color with time. Okay, so remember melanoma, it's named after the fact that they originate from melanocytes. Okay, now it's not those moles you were born with. Okay, moles that you are born with, they don't grow in size significantly as you with time. Okay, maybe years and years and years, but usually they don't grow uncontrollably within a short amount of time, or starts kind of developing these asymmetry and things like that. So that's what you need to look out for in terms of melanoma, is when some brown spot that appears and then it gets bigger and bigger with time, and the bigger in shape is not symmetrical. Maybe there's a, sort of here and it starts growing there, kind of growing all over the place. Okay. So it's not, it's changing in shape, changing in symmetry, and sometimes even changing with color. Okay. All right. Oh, and that's I put that thing in front of the eye. So let me erase that. So this particular here, this spot here, is a melanoma that has developed within the iris of the eye. Because technically speaking, wherever there's melanocytes, they can become melanoma. All right, so sometimes the color of our skin provides some indication of our health as well. The first one is not harmful, just an interesting observation. For example, if you ingest large amounts of food that contain high levels of beta carotene, like carrots, squash, sweet potatoes, those, all kind of yellowish orange, it actually causes your skin, it can cause your skin to look a little bit orange, like this picture right here. Okay, these two pictures. Carotene from the food that you eat can accumulate in skin cells, and they are most apparent when they accumulate in the stratum corneum layer of light-skinned individuals. So again, this is more obvious in those with paler skin, and if you eat, I don't know, like pounds of carrots every single meal or something, then that's what you will see on your skin pigment, is that they tend to look more orangey or yellowish in color. Now, dermal circulation can affect our epidermal pigmentation as well, okay? There are a lot of capillaries we talked about. That's part of the subpapillary plexus. And when those blood vessels dilate, there will be more blood flowing through them, which is the reason why what gives one those rosy cheeks, okay? When someone's embarrassed or someone's hot, okay? So those blood vessels will dilate, more blood rushes into those areas, and that's why you end up with blushes on your cheeks or redness on your skin. So when we're exercising, we get hot, and that's why we turn red, and sweating is because those blood vessels underneath our skin is dilating. Not that we all of a sudden form red pigments, but the red pigments are coming from hemoglobin in your red blood cells, okay? All right, and we talked about how homeostasis of body temperature has to do with vasodilation, as we have learned in chapter 1, okay? On the other hand, if blood supply is not enough, okay, and for example, in the case of anemia, people with sickle cell anemia or any type of other anemia, not enough blood, and now you have less blood going through blood vessels in the skin, then of course skin will appear more pale. So this is rosy cheeks right here, and this is pale cheeks, okay? For example, when we're scared or when we feel sick during those times, blood is directed to other more needy organs in those situations. We'll talk about autonomic nervous system in terms of parasympathetic and sympathetic mode. And when we are in that sympathetic mode, when we need to activate all those muscles for running away from something, is our fight or flight alert system, then that's when all the blood drains to other areas. And that's why when you're scared, you look more pale. And when you're sick, then of course blood is redirected to fight the disease versus just blood going through underneath your skin. Okay. All right, so if we have sustained reduction in oxygen level, it can actually result in what's called cyanosis. Okay, cyanosis, kind of the name speaks for itself. Cyan is color of that bluish looking color. So that's why it's called cyanosis. When you have reduction in oxygen level, your hemoglobin will then release more oxygen and turns into a darker red color. which then from your skin look from the surface will appear more bluish in coloration when we have darker red hemoglobin around. Okay, so it's usually easiest seen in thin skin. So areas where we have really thin layers of skin is, for example, our lips and underneath our nails. So this is why when someone is losing blood or in the situation where they're anemic, you will see their lips turning pale or turning purple, and also their nails as well, and especially if one is losing oxygen. Okay, so jaundice is actually a common way to tell that something is going on with the liver. We will talk about the recycling process of hemoglobin in AMP2, but one of the important roles that the liver play is to get rid of that yellowish color substance from our body by turning them into bile. Again, that's the main job. We'll learn that in the liver, there's actually a gazillion jobs that it does, but one of the main jobs it does is to produce and secrete that bile. But if something is wrong with the liver, then it usually ends up being unable to secrete that bile, and a yellowish pigment accumulates in body fluids. So this is why the skin or the white of the eye would appear and turns yellow. So for babies that were born prematurely, unfortunately, their liver sometimes is not fully developed yet, and hence this is why they can have jaundice, and and why you need to put those premature babies under the lamp, the quote unquote, is what helps destroy those yellow pigments, kind of standing in the place and doing the job of the liver. Now, some tumors in the pituitary gland can also lead to give you a sign of different skin coloration. Okay, so when the pituitary gland is increased in size, you will end up with increased secretion of a hormone called melanocyte stimulating hormone, or MSH. This actually leads to overproduction of melanin that makes the skin appear more of a brown and bronze color, darker color. Now, Addison's disease also has the same darkening of the skin color due to overproduction of another hormone called adrenocorticotropic ACTH hormone by the pituitary gland. Now, this is actually a secondary effect because Addison's disease causes underactive or damaged adrenal glands, which leads to insufficient amount of cortisol. And hence, in response to that, the body keeps releasing more ACTH to try to signal the adrenal gland to release cortisol. ACTH is released by pituitary gland. And that's what we call the pituitary gland, the master gland of our endocrine system, is because a lot of other hormones we have that's released by other endocrine system has to have a main command coming from the pituitary gland. And that main command a lot of times comes in form of a hormone. In this case, ACTH is what activates the adrenal gland to release cortisol. But if Addison's disease causes damage of adrenal glands, you cannot release enough cortisol, okay? But your pituitary gland, all it sees is, well, there's no cortisol. So I gotta tell the endocrine system to keep releasing more cortisol by releasing more of this ACTH hormone. So that's why it's a secondary effect of increased production of ACTH, not because it was the pituitary gland all of a sudden is malfunctioning. It's because the adrenal glands is not functioning correctly, which then leads to malfunctioning of your pituitary gland to falsely overproduce ACTH, which then ends up with the same effect as when your pituitary gland has cancer cells in them. Okay, so that's why that would also ends up with that same bronze color. All right. So when individuals lose melanocytes, now this is different from albinism, what I was talking about earlier. Albinism was a genetic condition that usually comes from usually ends up with mutation that causes the melanocytes to not produce melanin correctly. Okay, melanocytes are there, but they're not producing melanin. For vitiligo, it's a different type of skin pigmentation disease where these individuals actually lose their melanocytes. Okay, so but when you lose those melanocytes, and that's why then you can't form melanin, and that's why you end up forming these white patchy area on the skin. Okay, now the cause of vitiligo is still unclear, but it may be due to an autoimmunity problem where the immune system attacks and destroys the melanocytes specifically. But other than losing pigmentation, there's really no other side effects of this with this disease, but it is highly associated with other autoimmune diseases that can have other effects. But vitiligo itself, technically speaking, other than losing pigmentation, there's no other effects. And that's why usually it's a rare thing, only affecting about 1% of the population. Okay, finally, we can move on to accessory structures of the integumentary system, which is your hair and glands. So hair, just like superficial skin cells, are considered as non-living structures. And they are produced by living structures or living organs called hair follicles. And that is why your cutaneous plexus has to deliver blood to hair follicles. It's because they are living cells that require all the nutrients and, requirement a normal cell needs. And hair does contribute useful function other than just a fashion statement. You might agree with some of these or you might not. But supposedly, according to the textbook anyway, it helps with protecting your scalp from UV. Okay, that makes sense. You kind of shades your skin on your scalp from direct UV rays. Your textbook says it cushions light impacts to the head. That depends how thick of hair you have on top of your head, I guess. But I have pretty thin hair, so I can't imagine my hair helping me cushion from a soccer ball hitting my head. But hey, it's different for everybody. And insulates the skull in a sense, because now you have that extra, sort of covering over the scalp. And that's why people that, don't have a lot of hair on the top of their head end up wearing caps a lot of times outside, is because not only does it shield them from UV, but when it's cold in the wintertime, it keeps them warm. Okay. Nostrils and ear canals and eyelashes also have hair. Now, those hair definitely does something important, such as for keeping out foreign particles or insects from crawling inside to those open spaces, like your opening of your nose or opening of your ears, or even within your eyes. Okay, and we'll actually talk about a bug that lives in harmony on our eyelashes, because they end up eating those dead cells around that area. We'll talk about that in chapter 17 when we talk about anatomy of the eye. So the hair follicle actually extends deep into the dermis area. Remember, this is the dermis, this is the epidermis. So here's that hair follicle we're talking about. And it reaches the subcutaneous or the so-called hypodermis layer. This is where they are able to receive that blood supply. You see those red blood vessels, artery and vein going into the follicle and coming back out. Okay, so that's coming from that cutaneous plexus we're talking about that gives that blood supply to the hair follicles, because they need those nutrients as living cells. Now, we're going to talk about other parts within the hair part, which is root hair plexus and erector pili. Now, don't confuse the circulatory plexus with root hair plexus. Remember, when I talked about plexus, it just means it is a network of something. Okay, so it doesn't have to be blood vessels. It can be nerves as well. So in this case, root hair plexus is not talking about blood vessels supplying the root of the hair. It is actually a network of sensory nerves that surrounds the base of each hair follicle, so we can feel hair movement. It's kind of like when hair is, wind is blowing against our hair, for example, and and we feel our hair moving with the wind, or if someone pull your hair a little bit accidentally, if your child pulls your hair a little bit, you feel, ouch, that hurts. Well, that's because there is root hair plexus in this area. You see this black line going and feeding into the hair area. Those nerves are what's going to sense that sensory information of either someone pulling your hair or the wind is moving your hair around, and then which sends that movement as sensory information toward your central nervous system in order to feel that someone's touching your hair or someone's moving your hair. Okay? All right. Another accessory structure within the dermis layer is called the arrector pili muscle. And this is a pretty interesting muscle. Okay, first of all, the name itself kind of speaks for what it does. Arrector. It erects something. In this case, it's a bundle of smooth muscle fibers or muscle cells right there. And it contracts when it's stimulated. Okay, and when it's stimulated, it pulls on this hair follicle and forces that hair to stand up straight, okay, which then gives us what we call goosebumps, kind of like when you're cold or you're scared, you can get that chicken skin or goosebump. Well, that's because your arrector pili muscle was stimulated by your nervous system to pull on it, and that's why your hair stands up. Now, note that this is smooth muscle cell, which means it's involuntary. We cannot control and tell our hair, hey, hair, just stand up. Okay, we can't control that. Okay, it's controlled by involuntarily with our nervous system. Okay, so that's why it's smooth muscles that's pulling those hair shaft upwards. Okay, so arrector pili, arrector, just remember it means erect, it's pulling on something. Okay, and then you have hair roots and hair shaft. Okay, hair root is just the base of your hair going towards the hair follicle region, and then your hair shaft is right here. Which extends to that exposed tip of the hair. Okay, hair root anchors your hair to the skin. Okay, all right. So within the hair follicle, hair production begins at the hair bulb around what's called the hair papilla. Okay, so this is the hair bulb right there. And then you have your hair papilla, which is this region right here. Remember I said papilla always kind of deals with this curvature finger-like looking thing. Okay, so that's why this is also called hair papilla. And then with those hair growing and into the hair follicle, then that is where we have this hair matrix area that slowly ascends upwards in which forms our hair. Okay. All right, so the hair matrix have what's called basal cells, just like how we have basal cells within our stratum basale layer of the skin. So these basal cells within the hair matrix is what's going to divide into hair cells and pushes those cells upwards to form that core of the hair, okay? Just like our skin. Keratinization also happens for hair just like your skin. Okay, so just, whenever a cell needs to become a dead cell, some sort of keratinization is required to produce more keratin to support that cell and also dehydration process. Okay, and that's why our hair is not slimy and doesn't have to be moisturized by mucus cells. All right, so hair can also provide different types of information about a person, and this is the interesting part about hair to me. For example, hair follicles is what will contain DNA information for DNA profiling. Okay, note that it is follicles that will contain DNA information. When you pull out a strand of hair and you see that tiny, small little white dot at the end, the head of the hair. So that is the hair follicle that contains lots of DNA information because those are, technically speaking, live cells here. And is what contains that nucleus. But when it becomes a dead cell, going through keratinization, remember, nuclei organelles disintegrate. So that's why, technically speaking, broken ends of hair, let's say you're cutting hair and you have pieces of hair on the ground, technically speaking, those broken ends do not have a lot of DNA in it. In very, very rare circumstances, I read somewhere online when I researched about this online, trying to read up on whether broken ends of hair contain DNA. They say that sometimes in rare situation, some DNA may escape into the hair cells and gets trapped in there, and they may have small, very tiny amounts of DNA within broken ends. But technically speaking, if we want to intentionally leave our DNA somewhere, we need to pull out the hair follicle as well for all that DNA information. Okay. So the other thing is sometimes we can have certain metals in the body that can be revealed in the hair sample. For example, lead or other heavy metal poisoning can be detected within hairs, or even sometimes certain drugs can be detected in the hair if the person routinely takes a drug like marijuana or amphetamines, for example, that can appear in their hair. So, hair follicles, just like urine or other areas of the body, kind of tells a lot about a person, okay? All right, so the two main types of glands we'll talk about in the skin are sebaceous and sudoriferous glands. Sebaceous glands are the oil glands of the skin that releases oil, some sort of lipid secretion, and we call that sebum. Okay, so sebaceous glands, seba for sebum. Okay. And they release sebum into hair follicles, okay, and onto the epidermal surfaces. So here's your picture of your skin, for example, and here are those sebaceous glands or sebaceous follicles around here, and it actually can release oil through onto the surface of the skin, or through the hair gap there onto the surfaces of the skin. So even though oily skin seems gross, but just like how I talked about with UV rays, homeostasis, we still need a little bit of it. We can't have no oily skin, some oil. So because we need a little bit of skin, and what sebum helps with is inhibit growth of bacteria or lubricate and protect that hair shaft and conditions the skin. Okay, so this is why if you read on somewhere else, or you've heard of this before, is if a person constantly washes their hair, let's say 5 times a day or something, you're actually not allowing the sebum to accumulate on the hair, and actually can have opposite effect of conditioning and making your hair looks nice. So you don't want to have no sebum on the surfaces of your scalp. Okay, it actually helps with some antimicrobial stuff. Okay, so usually oil is released from gland cells into hair follicle by contraction of erector pili. So not only is erector pili responsible for result of having goosebumps, they actually, every time it pulls right here, it squeezes on this sebaceous gland, which then adds oil onto the surface from the sebaceous gland onto the surface of the skin or the scalp. Okay, if we're talking about hair on top of your head. Now, gone to too much. Okay, so we can't have no sebum, but we can't have too much either. Homeostasis. Okay, when there's too much oil release is not a good thing. Okay, this can happen when someone have what's called seborrheic dermatitis. Remember, itis for inflammation of the dermis layer, and this is specifically talking about an effect to sebaceous gland. So that's why it has sabor for sebaceous, acting on sebaceous gland. So seborrheic dermatitis is an inflammation that causes abnormally active sebaceous gland that leads to overproduction of oil, and it often happens on the scalp, of course. And the affected area will get really red, inflamed, oily, and you will usually end up with lots of epidermal scaling, which is why people with seborrheic dermatitis usually ends up with a lot of dandruff or sort of sheets and small little pieces of skin cells scratched off their scalp, is because of all those oil that's abnormally being produced on their scalp. Okay. All right. So the other type of gland is called sudoriferous gland, which are those that release sweat. Now, sweat is technically speaking 99% water made with a little bit of salt, sodium chloride, and the pH can range between pH 4 and 6.8. And you can tell this is actually slightly acidic compared to the neutral pH of our body. So this slightly being acidic is what will, again, help with prevention of growth of microorganisms on our skin. So sweat has a purpose, just kind of like sebum. Okay, and other than that, sweat has a few other functions, such as cooling surfaces to reduce the body temperature, as we have talked about in chapter 1 with homeostasis of your body temperature. Our sweat glands, which specifically now we know the fancy name for sweat glands is called sudoriferous glands, and sudoriferous glands is what will release sweat to cool down our bodies. It also acts as a way to excrete water if necessary, and also if there's any electrolytes that's coming out. And I already talked about minimizing growth of microorganism, because not only is the acidic property part of it, but it actually sweat actually contains something called dermacidin. Okay, dermacidin has some antibiotic properties that can kill some basic bacteria. Okay, so in some specialized areas of the body, there may be other glands that serve the purpose of that particular area. So sudoriferous glands, sebaceous glands is mainly in general area of all our skin, but specific localized sections of the body may contain other glands. For example, the skin around the breast area, in the areola section around the nipples, you have receptors for sensing the babies sucking on the breast, and also within the breast you will have what's called mammary glands, which is affected by sex and pituitary hormones that control secretion and production of milk in these mammary glands. We'll talk about that in next semester in AMP2. And then you have cereminous gland, is actually in the passageway of the ear. So, a general common term for that is earwax. So, those sebaceous gland within the ear canal is producing cerumen. Okay, so it's not called sebum. Sebum is for sebaceous gland on the skin, and then cerumen is released by cereminous gland within the ear canal. And again, little bit of earwax is supposed to help for preventing foreign particles from reaching the eardrum, which you don't want your eardrum to become infected. If it really gets severely infected, it can affect the hearing of the child. And I talk about in terms of a child is because a lot of times ear infection, as we'll talk about when we get to the hearing, often happens in children. Okay, so you don't want those foreign particles to infect the eardrum. Okay, so that's why you have those earwax and cerumen to help prevent that. But again, you can't have a lot of earwax within your ear canal, because that can then be too much and block sound waves coming through and block other stuff that you don't want to block. So you want a little bit, that's why it produces earwax, but it also makes us why we have to clean our ear canal sometimes from too much accumulation of that earwax. Okay. So we talked about the process of inflammation in the last chapter. So now what happens after inflammation when we have a cut in our skin, for example? So the process of skin repair occurs in 4 different phases. You have to know these 4 phases. So make sure you know what the names of these 4 phases and what happens within these phases. So first is called the inflammation phase, which is what we have already discussed previously. So I'm not going to go back into details about this again. The second is called the migration phase, which involves movement of the stratum basale cells around the edges. So here's that cut you have, and your stratum basale cells actually have to travel downwards here and here towards the, reconnecting the 2 broken ends of the epidermis. That's what they're doing. And they will divide into new keratinocytes that will, in a sense, repair and close up the wound. Now, phagocytic cells, so basal cells are doing something. Phagocytic cells are also moving into the area to help get rid of any pathogens that have entered into the wound. Because once you have compromised your physical barrier of your immune system, your first barrier to microorganisms, now microorganisms are everywhere and they can get inside to that cut area. So that's why now phagocytic cells are going to come in and try to fight those, like mast cells and macrophages. Those are your phagocytic cells. Your macrophages and is what's going to come and try to get rid of those, okay, and stop them from giving you an infection. Blood will clot in the area as well to temporarily cover up the wound and stop the bleeding, which is what I was talking about in the first chapter with positive feedback, with platelets going to that area and causing clotting of that area to stop the bleeding. Third phase is called the proliferation phase, which is when fibroblasts, remember we talked about specific cells that produce collagen fibers in your connective tissue. So fibroblasts are then going to be activated and proliferated. Proliferation means they are multiplying in large numbers. So fibroblasts will then produce lots of collagen fibers to rebuild that dermis layer. And they will increase in the activity to really rapidly rebuild the structural support underneath within the dermis layer of the skin. The clot will dissolve while the structural makeup underneath will continue to push up towards until the scab is completely removed. Okay. And lastly, it's called the scarring phase, where that scab is completely shed away and you have, excuse me, regeneration of the epidermis, and the dermis layer is now completely finished. Okay, and then first you will feel a depression, a shallow depression around that area, but it is the natural process that fibroblasts in the dermis will continue to overproduce the tissues that's underneath. So fibroblasts, they will continue to produce those collagens, tissue fibers, all that stuff, and elevate the epidermis, which ends up creating what we usually end up seeing in a scar as a small raised area, okay? And sometimes it can form a keloid, okay, where you have a really, really thick raised area of scar tissues. Okay, so when skin is burned, there are 2 ways we can evaluate the severity of the burn clinically. We'll end the chapter with the degrees of burn and the depth of, and the surface area of burn called rules of 9. So we can go by depth and surface area by percentage. Okay, so these are 2 clinical evaluation of severity of burns. So depth of burn is evaluated with the degree of burn: 1st degree, 2nd degree, 3rd degree. 1st degree burn is when only the surface of the epidermis is damaged. For example, in the case of sunburn, like I was talking about, the skin will appear red. Again, this appearance of red is called erythema. Okay, and will feel painful. So erythema is what's happening to the epidermis layer for the first degree burn. The second degree burn is when the entire epidermis and some of the dermis, so this entire epidermis and some of that papillary layer of the dermis is damaged. So this can lead to blistering, okay, which is associated with burning. Sometimes you see a little bubble, watery bubble forming on top. That's part of the blistering. So make sure we don't want that bubbly part to rupture, because when it's meant to protect that area of the skin before the skin is completely healed and regenerated. So rupturing that water bubble will actually lead to infection, because now you're exposing all this dermal layer underneath, and that dermal layer is watery, mucousy, and everything will get stuck there, and it starts an infection. An infection of large area of wounds can lead to sepsis, so we never want that to happen. It will feel very painful, and of course you will have swelling. For secondary burns, it takes about 1 to 2 weeks to heal. And lastly, the most severe burn is third degree burn, when your entire epidermis and your dermis is completely damaged. We're talking about going really deep into the skin and sometimes even some of the subcutaneous layer. There will be swelling, but compared with second degree burn, interestingly, third degree burn feel less painful, because now you are destroying the sensory nerves that's within those layers, because there are sensory nerves here in the epidermis and upper dermis layer, but there's also sensory receptors here too, like the Pacinium receptor we were talking about, Pacinium corpuscle we're talking about. Now all So if we're talking about destroying this whole layer up and this whole layer up, all those receptors and nerve cells are also gone. Okay, so this is why third degree burn will feel less painful compared with second degree burn. Now, for third degree burn, usually you end up not being able to heal on its own because it's so severe, and a skin graft will be necessary for healing of third degree burn. Now, for estimation of surface area of burn, you have what's called rules of 9. Rules of 9 is where the surface area of the body is divided into multiples of 9 for the adults, and damaged regions are then totaled depending on how much of those areas are damaged by the burn. So burns that cover more than 20% of skin usually is life-threatening due to the fact the skin we just talked about, all those important functions the integumentary system is serving for. It's supposed to serve us and protect us against dehydration and fluid loss. So when you have you remove the major majority part of the skin, then you have a lot of fluid and electro balance that is lost. Your thermal regulation is lost because your skin is providing insulation as well. And sweat glands, okay? If we're talking about third degree burn, sweat glands right here are also destroyed. Now you can't sweat. That's why thermal regulation is gone. And protection from infection is lost because we talked about integumentary system being your first line of defense against pathogens and microorganisms. So they're very, very prone to infection. And what I was talking about in terms of sepsis means widespread infection throughout the entire body, and that can actually lead to death in some burn victims. Commonly, they end up with sepsis. And don't survive through the sepsis because of widespread infection. Okay, so the rules of 9 here is where, for example, the head is considered as 9%. The one upper limb is considered 9%. So if both arms are burned, then that's equivalent of 18%. If the trunk is burned front and back, then it's 36%. And then you have your lower limb, one limb being 18%. So that's why it's called rules of 9, because you have multiples of 9 here when we're talking about these different areas of the body that is burned. And the genitalia makes up 1%. If that area is also burned. For a child, it's a little different and it's not really multiples of 9, but here's the sort of reference for in terms of estimation of surface area burn for a child. Now, skin graft is where you can remove small areas of intact, healthy skin and sort of run it through an instrument that can smush the skin into forming a bigger piece. That bigger piece can then cover up, wound area of large areas of burn or wound areas. So, usually a skin as small as almost like a postage stamp size can then be smushed to a really big piece of dressing that we can put on top of skin like that. And how it is able to create such a large area of coverage is because you're smushing the skin cells, and also you are creating these holes acting like kind of like a mesh covering over the area, so you can already have some skin cells on top to stimulate the repair and healing process. Okay, so that's what skin graft does. Okay, so we are on to the practice question for this chapter. This is a shorter chapter compared to the others. So let's go to the practice question and we'll be done. What is the usual length of time it takes for a cell to move from the stratum basale to the stratum corneum? 7 to 10 days. So that's what I was talking about, how your surface of your skin can be 10 days or more because, they're hanging around out there in the most superficial layer of your stratum corneum for 2 weeks before they're regenerated and shed away. Which layer of the epidermis is only present in thick skin? Stratum lucidum. Okay, remember, come let's get sunburn. So the let's part only is present in thick skin. Thin skin only have the come get sunburn. Okay, some criminals sand the tips of their fingers so not to leave recognizable fingerprints. Would this practice permanently remove fingerprints? Why or why not? We talked about this. No, because the original ridge pattern will regenerate from your epidermal ridges. Which of the following is not a role of epidermal growth factor? Converts cholesterol-related steroid to cholecalciferol. Remember, that is not the function of the factor itself. It is a cholesterol steroid product within the skin that gets converted to vitamin D3 in exposure to the UV light. Nothing to do with the epidermal growth factor. Epidermal growth factor is for regrowth and regeneration of the skin cells. Where would a subcutaneous injection be made in the skin? Usually in the hypodermis area. Remember, I talked about how your subcutaneous areas where you have a large supply of blood vessels. So that's why injection into those areas will usually hit a blood vessel, which in turn going into your circulatory system very quickly. What is the clinical significance of a cut in the skin made parallel to lines of cleavage? They will heal with little scarring because those collagen and elastic fibers are in parallel bundles along with the lines of cleavage. So better healing and less scarring. What are functions of sebaceous secretions? So it's all of the three choices. It inhibits growth of bacteria. Sebum is what lubricates and conditions the skin. That's why I don't wash your hair 6 times, 10 times a day. It lubricates and protects the keratin part of the hair shaft. Deodorants are used to mask the effects of secretion from which type of skin gland? So deodorants are blocking sweat, which then has to do with sudoriferous glands. Cereminous is those that reside in your ear canal. Sebaceous is oil glands. Mammary glands is in the breast area for production of milk. Mr. Wilson is exhibiting yellowed skin. Which of the following condition does he have and what is its cause? Jaundice, okay, and the underlying cause is very much related to the liver. So something's going wrong with the liver that leads to yellowing of the skin due to inability to secrete bile. Spending all day indoors and having no dairy intake is highly correlated with bone disorder. What is the connection? Remember, UV light is necessary for producing a hormone called cholecalciferol or vitamin D3, which then makes calcitriol. Calcitriol is then what promotes calcium ion absorption within the small intestine. So that's why sun is, in a sense, mechanistically related to how strong your bones are by affecting how much calcium ion you intake. UV radiation striking the skin does what? Both A and B. It can mutate cells' DNA and cause cancer, and can also break down collagen fibers that result in wrinkles, which we talked about. Which statement below is true about a skin condition known as vitiligo? It is frequently associated with an autoimmune problem where the immune system attacks the melanocytes, specifically destroys them, and that's why you end up with patches of white or paler skin, because now you don't have melanocytes to produce melanin. Why does the skin of fair-skinned person appear red during exercise in hot weather? Well, in hot weather, it promotes vasodilation to cool down the body, and that leads to more blood rushing to that area, resulting in that red pigmentation of the skin. Which statement below about burns is true? Both B and C is true. Third-degree burns will extend deep into the hypodermis. Surgical procedures are necessary for repairing third-degree burns. Now, A, first and second-degree burns are called full-thickness burns. That is not true. Okay, first-degree burn only affects the epidermis, which causes that erythema, redness of the epidermis. Second-degree burn actually goes slightly into the dermis layer as well. Okay, and that is all I have for practice question. There will be an associated case study for skin, if I remember correctly. But if I'll recheck on that, okay? And then it will show up on eCampus if there is a case study assigned for you guys. Okay, so I will see you again, and we will move on to the skeletal system for Chapter 6.